because I was, too stubborn to die.
That's one way to put it. Undergoing one organ transplant is huge. This patient had 2 transplants at the same time. Coming up on today's All Things Heart, we share his wild journey to better health, along with the medical teams that saved his life.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, March 30th. I'm Alexis Del Cid. Welcome back to All Things Heart. Here's what we're talking about today. Congestive heart failure. According to the CDC, more than 6 million people in the U.S. are in heart failure right now as we speak. We look at the warning signs and what you can do to prevent it, along with the story of the man who had a 1-2 punch, heart and kidney failure. And later, we go behind the mask with the talented medical teams that saved this patient's life, seeing him through 2 organ transplants. What do they like to do when they're not saving lives? They do have lives outside the hospital. We'll show you what they're up to. And we love hearing from you. Your questions and your comments are the heartbeat of every program, so please be sure to send them in to us on YouTube, on Facebook, and to the All Things Heart email. You can find all the links right here on your screen. Congestive heart failure happens when your heart doesn't pump enough blood for your body, for what your body needs it to do. There's no cure, but there are several treatments available that can help most people continue to live a quality of life. However, if it's not treated properly, heart failure can damage your other critical organs. That's exactly what happened to Carlos Chapman. It's been a heck of a journey for Carlos Chapman.
Because I was, too stubborn to die.
Is what they said.
Yeah.
One that led him to undergo a heart transplant and a kidney transplant in the same day during the same surgery.
Essentially, he has 3 kidneys in his body because they didn't remove.
They didn't remove none of them.
The other kidney.
My other kidney's sitting right here.
It began when Carlos was diagnosed with congestive heart failure back in 2014, which he managed with medications. But in 2021, his girlfriend Dawn noticed changes.
He was so tired and so winded, and he could barely do anything.
And Carlos was refusing to slow down.
So he kept ignoring it, but his body finally said, no, enough is enough. We've got to do something different.
They came to the University of Kansas Health System for tests, and shortly after, his doctor said,
"You're not going nowhere."
Carlos needed a heart transplant and a kidney transplant as soon as possible. Dawn's words were much more direct.
She said I'm too damn stupid to understand, and I was going to die.
Pretty much. That's where we were sitting.
Then they made each other a promise.
Well, we promised each other, you will live. There's no giving up. We have to get through this.
I got 15 more minutes on this.
And they've kept that promise with the help of the cardiac and transplant teams.
They are some geniuses. They are really damn good at what they do.
And thank you.
Both Carlos and Dawn say they are so thankful for the donor who gave Carlos a second chance at life.
The last thing you want to have to do is say that we're not going to win this, and that it's not going to turn out the way we want it to turn out, because it was close.
How close was it?
Well, let's say, the way I look at it, you have a new heart, which means you have a new birthday. It was close.
We are so thrilled to have our heart and kidney transplant recipient, Carlos Chapman, joining us today. Carlos, you are the down player of down players when it comes to your health. We're going to get to that in a minute. But we also are so happy to have thoracic surgeon Dr. Matt Danter, who performed the heart transplant. We also have heart failure and transplantation cardiologist Dr. Andrea Vidic, who is Carlos's primary cardiologist. And we have transplant nephrologist. Our nephrologist is Dr. Malika Gupta. Now, a nephrologist, if you're not familiar with all the medical terms, is a doctor who deals with the kidneys. First question we've got to ask Carlos, because you look amazing. How are you feeling?
I'm feeling pretty good.
The first thing
besides
you
of the
said,
side effects.
yeah. And the side effects are?
The tremors, jitters from the medication or steroids, I guess. One of those, but that's pretty much it. You have your little fatigue. I'm not where I used to be, but I'm better than what I was. A lot better, 100% better than what I was.
Oh, absolutely. Even since when we first interviewed you, Carlos, you look like a different person. You look so healthy. There's color in your cheeks. You could just see when you walked in, you're like a different guy. And yet the first thing you said, or one of the first things this morning was, I don't see what the big deal is. Do you understand kind of what a big deal it is to have a heart and a kidney transplant at the same time?
I am slowly but surely getting to understand it and coming to realization that this is what happened. That's my biggest deal. And when I woke up with the heart, I pretty much thought that was it. I just had a heart, but no, and he said, well, you got a kidney too. And I was like, okay. I mean, at the stay in the hospital almost 4 months, and I was pretty much out of it, and I wasn't. My outlook on life wasn't that, bright, and I was just in I guess, a down state of my existing, I guess, and when it was all said and done and over with, and I was like, the only thing I can remember is waking up with a tube in my throat, breathing tube, and it was choking the heck out of me. The next thing you know, they put me back down, and I guess when I woke up and they say it's all done. I was like,
wow.
Okay, what's, I'm trying to, I'm feeling around, my chest is sore, my belly is sore, and I'm like, what is all this going on? I was just so amazed
that process.
Yeah, it was, and I was just, just laying there, just like, okay, what's next? That's my biggest deal is what's next? What I'm going to do next, and as my dad was saying, live.
That's what's next.
That's what's next.
You live.
Yes.
I want to ask our doctors some of the questions about the process because there's a lot going on here. First question is for Dr. Danter. How critically ill do you have to be to actually qualify for a heart transplant? What was the tipping point for Carlos?
Well, basically you have to be, at the point of your end-stage heart failure where you are no longer responding to medications, even some of them intravenous medications. And at that point, we have options now, but in Carlos's case, he also had significant kidney disease, so our other options, things like mechanical assist devices and these kind of things are far less desirable. So you have to basically be someone who's failed optimal medical therapy.
Like it's the last resort.
Yeah, we try not to do it in the instance that it's the last resort, but that's honestly what most of the patients that we do have no other real significant options that are in any way as durable as the advanced heart failure surgical therapies we have.
You and Dr. Vidich sent us some imaging of a heart, and I'm hoping you can guide us and the rest of our viewers through these images, because for us, it's kind of hard to decipher what's normal for you to look at all the time. So what are we looking at there?
So we were looking at basically heart as a cone, and we can see that most of the time the heart squeezes and most of the black kind of gets obliterated. And in Carlos' situation, you can see it's almost the wind blowing and the heart is just moving. There's not much movement at all.
Oh, we're supposed to see those black gaps closing?
Almost closing.
Okay.
More than 50%, and in Carlos' situation, nothing is moving.
So how long did Carlos have to wait once he qualified for a transplant for the heart to be available?
So, as Carlos probably remembers, he had a wild ride for those weeks. But once he was placed on the list, he waited almost a month to get transplanted, and he had many setbacks along the way while on the list because he was getting sicker and sicker. And we had multiple discussions with our surgeons, our nephrologist, Dr. Tim Schmidt, who's abdominal surgeon. Should we even proceed because he was getting so critically ill, and he had some complications. And well, we saw the will to fight in Carlos, and we said we should give him every chance because he would get down but always get up. And that's one thing that you don't underestimate in a patient, the person who keeps getting up. And
that's what Carlos calls his stubbornness.
Yeah.
But you would call it
We
strength.
call it resilience.
Right.
Yeah, probably.
Probably
But it's true. He had an extensive sort of pre-transplant course that was very complicated. And multiple times we sort of had to reevaluate whether or not we could move forward. And I think everybody's glad that we did.
So Dr. Gupta, when were you brought into the process? Because when I said all the doctors who were here today, when we were getting Carlos, he said, Dr. Gupta, I know her so well. So tell me about your first meeting with Carlos and your role in this process.
Yeah, so in my role of transplant nephrologist, I was brought into the process when the decision was made that he needs a kidney as well. That was, I would think, September, maybe like 30 days into his admission of his bleeding gum when he was admitted. When the decision was made that he needs dual organ, I was brought into the process.
So would Carlos, if Carlos had just needed a kidney and it wasn't his heart, would he have had to wait longer for that kidney? Is that process sped up at all because he needs two at the same time?
Yeah, the wait time for an isolated organ, if you just need a kidney, is much, much longer than if you need a dual organ. Okay. So kidney can be transplanted with multiple other organs as well. Most of the time, if the patient needs dual organ, the time is much, much shorter because, as you know, we have life-saving procedure, which is dialysis, that mitigates the urgency of needing a kidney. So therefore, once the patients get listed, it's a long, long process if they're just waiting for a kidney.
We know we're giving you a lot of information today about transplants. So if you're curious about heart transplants or any transplants, scan the QR code on your screen. We have it up right now. That will take you right back to our health system webpage, which has all the information on transplant, risks, and options for you. Dr. Vidic, Carlos's girlfriend, says she felt like he had waited too long to see a doctor initially. I mean, she had some choice words for you, Carlos, which you agreed with, admittedly. I want to ask Dr. Vidic, how close of a call was this for Carlos?
Well, I think if he stayed even a couple of days longer at home when he presented in the early summer, he probably would not be here with us.
Wow.
So it was very, very close call. And he actually tried to go home for a period of time, and he was pushing to go home, and he represented to the hospital within, I think, 4 days. So he was really kind of on downward spiral. Right. And despite multiple IV medication and temporary MCS, he continued to go downhill. So he had really tumultuous, even before we evaluated for transplant, he had tumultuous course.
So Carlos, what was the tipping point for you when you finally realized you couldn't muscle through everything?
Probably when I tried to pick up my drill. I couldn't use my cordless drill. I mean, none of my hand tools is just.
Your hands wouldn't grip?
I was just
do it?
No, I was just weak. I was weak. I couldn't hold nothing over my head.
Wow.
And at that time, I was remodeling the kitchen, and I just couldn't do what I normally do automatically. It was just, and walking to point A and point B, I was just so tired, wore out. Then I just find myself sitting down, then next thing you know, I was coughing a lot, and it just didn't feel right. And my balances, and it was just weak. It just didn't feel.
You just knew.
Yeah, something wasn't right at all. I mean,
now
I felt down before when I got congested heart failure, and when I went through that process, then I started getting better, and but now, I mean, then it was just like somebody just reached inside me and just took every air out of me. I just couldn't do nothing.
Jeez. So you said that you have 3 kidneys now. They left the bad one in. They left the bad one in. There's a technical term for saying that, I'm sure. But Dr. Gupta, is it normal to leave the non-functioning kidney in there and just put in another one?
So every person has 2 kidneys, which are located on the back side, and the new kidney goes on the front side. So this is a great question, but to simply answer it, I would say it's a risk-benefit ratio. So just the risk of taking those kidneys out is more than the benefit it will give you. And actually, it's not really hurting being in there because it's not functioning anymore.
So you always leave the old kidneys in there?
Yeah.
Even if you put in 2 new ones, would you leave the old ones in there? Or you would never put in 2 new ones because you could do with just one?
Isolated kidney, yeah.
Yeah.
So there's a lot of people walking around with 3 kidneys?
Yes.
And does it feel, this might be a weird question, but I wonder this, did you feel fuller, Carlos? Like there's something extra inside of you?
Sometimes it was weird from the beginning, you know, when the initial beginning, yes, it felt weird. Bending over, sitting down, and bending over, putting on your shoes or something like that. It was, you know, just that. But now, I'm more cautious what I do.
Yeah.
I try not to pick up anything that's close to my body in that area because now I know I have a kidney there, and I don't know. My thing is, I was going to ask a question: is how far is it in on the front side? You know,
that's a great question.
I wish Tim was here. So
is it sitting right under the surface?
No, it's typically placed in the pelvis in the retroperitoneal space. So behind the abdominal contents, they're moved to the side and it's put in there.
So does he need to be careful bending over and touching his belly and things like that, or is that just the natural? You know, I would be kind of weirded out too and be like, oh, there's an extra, right?
Yeah.
But does he need to be that cautious?
I wouldn't think so. No, I mean. No.
He's not going to hit his kidney.
No, you're not going to injure. You're not going to injure yourself by doing exercise or normal sort of movements and these kind of things. No.
I do want to ask about Dr. Tim Schmidt, because Dr. Tim Schmidt was also scheduled to be here, but he had a patient issue to tend to this morning. Dr. Danter, you've talked about how critical Dr. Schmidt also was in making this all happen. Can you just explain a little bit about the process?
Sure. So as you can imagine, this requires 2 surgical teams, and I just wanted to make sure that we took the time to acknowledge Dr. Schmidt and his kidney transplant team for all the work that they did, and also his sort of ongoing support for the program. This is a new sort of surgical program for KU and for and anytime you do something new anywhere, there's a need to have good support from all the people that are in it.
By new, do you mean doing 2 organs at once?
Yeah, that's first.
Yeah.
I believe that Mr. Chapman is the first heart kidney transplant in the history of the state of Kansas, I think.
Wow.
So we can confirm that, but there's the program prior, I mean, he's definitely the first one in the new iteration of our transplant program, and so I'm not sure the program prior had done one. But really, it doesn't come to fruition if you don't have support from everybody. And Dr. Schmidt has been a very stalwart supporter of our heart program as the director of for the Center for Transplant and for this program specifically. And it takes a lot of resilience to build something new. So I think he deserves a great deal of credit.
When it comes to the donor, is it from the same? Are both organs from the same donor?
Typically, yes.
They are. You're nodding your head, yes. And that's a typical thing. You'll have one.
Yeah, the heart drags the kidney. So if you accept the heart for someone who needs a heart kidney, then it's assumed that the kidney goes with it.
The kidney goes with it. I want to get to our community questions because we have a lot of questions coming in from our viewers. The first one is for Leslie. This is such a good question. I was wondering this, Leslie. What order do you do the transplants? Do you do the heart first and then the kidney right after, or vice versa?
There's 2 ways of doing it. So we did we did multiple of these when I was at Vanderbilt, and we had a different strategy there. Usually they would go do the heart transplant, recover to some degree in the ICU, make sure everything's fine, and then go back and do the kidney. Here we elected to just move forward with it in the same OR setting because the heart was functioning so well and there were no other sort of technical surgical concerns that would require some kind of recovery or sort of support.
So same time, but back
Same
to
time.
back.
So basically, yeah, that's another thing is that it's, you know, how fast and efficient Dr. Schmidt is at sewing in an organ. It made me look bad.
He made you look bad?
Yeah.
We'll have to have Dr. Schmidt on here to tease you, because these guys tease each other back and forth. Marie has a question that piggybacks on that, and I think you've touched on that. Marie wants to know if Carlos got moved to another room for a second transplant, or does, like, the heart team does its thing and leaves, and then the kidney team comes in and does its thing?
The heart is implanted. We make sure we come off bypass and everything's working well. Then we close up, and we'll stand there. We'll stand by to monitor, you know, all of the sort of post-transplant phase while he's getting the kidney implanted. So it was very, very rapid succession. So we do the heart first because it's the most time-sensitive organ that gets transplanted, and then the kidney. We have the luxury of sometimes, if we needed to, recovering a bit, and then alternatively, in this circumstance, was able to just proceed right ahead with that.
Beverly has a question. Beverly Van Horn, our Facebook viewer, wants to know, what is the oldest age to be a heart transplant recipient? I know we recently interviewed Jim Wagner, who was one of your patients.
Yeah. I mean, if you look nationally, there are some programs that transplant somebody even as old as 78. Our cutoff is really 75. There's, you know, previously, maybe 10 years ago, cutoff was really 65. But as we saw that older patients do as well as younger patients, so we have pushed the envelope to offer heart transplantation even in older patients. So our cutoff is 75.
Dr. Zubair Shah was Jim Wagner's transplant doctor, and he said he was 74, but he looked at the whole person rather than the age, and he was an excellent candidate for heart transplant.
It's, you know, it's team decision and also programmatic decision. It's not, you know, my patient, Danter's patient versus somebody else's patient. It's like programmatic decision. How aggressive is program? If you know, as program does more transplants, they become more aggressive, and they have ability to do a high risk procedure. As if you're doing lower volume and you're not doing a lot of sick patients, your ability to do high-risk procedures will not be there. So I think as program evolves, you can start doing more older patients, more different subgroup of patients who you would not offer transplant otherwise.
Maureen has a question for Dr. Gupta. Maureen wants to know, what are the symptoms of kidney failure if you don't have heart trouble?
That's a great question. Usually kidney failure symptoms start appearing when the kidney disease is very advanced, or if it's progressing very fast. Most often kidney dysfunction is noted on blood tests, so it's important that you do blood test with your primary care doctor. But to answer the question, some of the symptoms can be as minor as nausea, vomiting, itching, swelling in the ankles. It can go up to severe side effects like chest pain, even seizures, and it could be fatal if it's very severe.
Jim has a question for Carlos. Jim wants to know what life is like for you now, day to day. Are you back to working full time?
No, I'm not working at all right now, and right now the way I feel is everything is like almost like walking on eggshells. It's kind of nervous. Like, you know, you caution yourself before, you know, you think 3 or 4 times before you do anything. Before, I only think about once and just go right at it. Now I'm just like, you know, trying to go through the motions on, you know, the walking, the movements, the arm movements. Me personally, I like to work with tools, my hand, you know, with my hands. So I'm slowly but surely getting back into that, you know. But as I do use the tools and everything, it's just the endurance is what I'm working to build back up.
Right.
Because my endurance was just shot. So right now it's just, yeah, it's just slowly but surely just getting myself back into motion of
Carlos,
being physical.
Yeah. Carlos, you bring up such a good point again, is that I can imagine if you've had not 1 transplant but 2, you feel like we tend to walk around feeling like our bodies are eggshells after something like this, and you can't trust them, and they've betrayed us somehow. So When it comes to follow-up care, and I'll start with kidneys and then I'll go to heart, does he's being very cautious, even like bending over or grabbing anything, worried about the third kidney in there. So what does his follow-up care look like, and when will it be okay for him to kind of let some of those worries go?
Yeah, so there are a couple of things about that. First is the surgical healing that usually takes around 6 weeks to heal. Any scar usually takes that long to heal. So that's about lifting weight restrictions and all those things. And the second part is the degree of immunosuppression, meaning the medications that we give to decrease the immunity is very high in the first couple of months. So the follow-up in the first couple months is very, very intense. We ask him to come to clinic every week. We ask him to do labs every week. We ask him to be available on phone for medication changes and lab updates and all that. But as the time progresses, the follow-up increases in duration, so yeah, it slows down. But usually around 6 weeks to a couple months is when you should start recovering well.
At least letting go of some of those anxious thoughts that you might have. And then I want to bring in our cardiology team, Dr. Danter and Dr. Vidich. When it comes to him having a new heart in his body, at what point can he comfortably start jogging? I mean, he's working on his endurance and things like that, but doing physical things without worrying about how's my new heart going to handle this?
From a surgical standpoint, I like people not to drive for 6 weeks and not to lift anything heavy for 3 months. It's just to protect the sternum, basically, and make sure things are wound healing. But I think what Carlos is getting at is the fact that there's a lot of a psychological recovery that needs to happen as well. Sure. You know, like you sort of hinted at, getting to be able to trust yourself again, and to for a guy like Carlos, he's not supposed to be in this situation. He's supposed to be off slaying dragons and ruling the world and doing whatever he wants to do. And this is, I can imagine, would be a very humbling series of events to have happen for a guy that was as robust as Carlos was prior to him getting sick.
Yeah.
If you saw how sick he was prior to getting his surgeries and saw him now, you wouldn't think it's the same person.
Right. I mean, it looks like you're recovering in lightning speed compared to just when we interviewed you a few months ago, Carlos, but it's a different story when you're living it.
Yeah.
And that's where I want to kind of bring back our whole panel for some final thoughts from our guests. And Carlos, I want to start with you. You've repeatedly talked to us about how impressed you were with how your medical team prepared you with all the information. You had so much going on. Can you share more of that with our viewers?
About, I kind of spaced off there for a minute.
That's all right. It's a lot. You said you were so well prepared by this whole crew and every doctor and nurse and medical team member you dealt with. What about that was so special to you?
Oh, because they're awesome what they do. I mean, it's just like me explaining to somebody that how I will set up a wall, building a wall. What they do, how they will build a human body or fix a human body. Like I will fix a floor or fix a wall, or they are professional. They're awesome with what they do. They are really good. I mean, it's just, and they made me feel comfortable at a point that I was just, I believe in everything they spoke on and followed their instructions because they spent the time helping me. So I'm going to do exactly as they asked me to do to proceed on with with my life and not end up back in the hospital again.
Like, you love them, but you don't really want to see these doctors all the time.
You know what? We go out for coffee, lunch or something, that's fine, but little visit, make sure I'm doing good. But no. And like the nursing staff, those guys on the third floor, fourth floor, and the ninth floor. They did it excellent job. They are hospital angels, you should say.
I love that. Dr. Gupta, when you hear, you see a patient doing so well and saying he's going to do exactly as you tell him to do, that must feel good.
That's great to hear.
And what's it like to see Carlos doing so well now?
Oh, it feels amazing. That's why you do what you do when you see patients recover. And we have talked about it enough that how sick he was before the surgery, and he's doing so well, so it feels great.
Dr. Vidich, do you have any final thoughts?
No, I mean, it's a pleasure to see him. I mean, like Danter said, I would now recognize him, and just gives us, you know, that additional motivation to go out there and help another Carlos, because we have a lot of Carloses in our community. And just to see him, I mean, I honestly did not recognize him when I walked in.
Right?
Even though I saw him a couple of months ago.
Yeah.
I mean, Carlos, not to pick on you, but I think you gained at least 40 pounds. Or maybe maybe cameras make you bigger.
I'm trying to stop the gaining weight. I want to get back down to, you know.
But this is good. I mean, you're
so
healthy.
healthy.
You're eating well. You're good at doing stuff. I mean, I heard he walked from first floor to 9th floor. Using staircase instead of elevator.
What did that feel like when you heard that? Were you kind of wringing your hands?
It makes me winded.
Right. So, Dr. Danter, when we get to you, I mean, it's great to have a patient who's so, you say, strong-willed or stubborn, as people in his life might describe him. But is that a gift in a way for you to have that kind of a patient like Carlos?
We can always work with stubborn, yeah. But I mean, that gets played up a lot. But Mr. Chapman, in every interaction I've had with him, he's just been lovely and sort of charming and
there you go.
a great advocate for us. I also think that, you know, we need to acknowledge Dr. Schmidt's involvement as well.
Yeah, Dr.
And
Schmidt.
I think he'd be equally happy with how Mr. Chapman's doing, and with you know, how the program can proceed from here. So it's encouraging. It's very encouraging to see someone doing as well as Mr. Chapman is.
We love bringing you this next segment because it's one of our favorite parts of the program. It's when we get to give you a little peek behind the curtain at what our doctors are like in real life. It is called...
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
All right, so Carlos, I hope that's good enough for you. You wanted them called angels. We're kind of going with the superhero theme here. We want to know what our doctors do when they're not saving lives, so let's start with Dr. Vidich. Really, to get to know you, Dr. Vidich, is to know your family. You are clearly a family guy. Tell us about these people in this picture, these beautiful people.
Well, yeah. Well, I have 4 kids. Youngest one is Sophia, and that was her first birthday. So my wife Susanna, who holds our family together, and this is just 3 of us. I took them to Chicago, and we went to Field Museum.
That's ambitious.
Yeah.
You took all your kids to the Field Museum in Chicago?
Only 3 boys. I left Sophia with Susanna. They had girls' date, and we had boys' date. So we visited my mother in St. Louis, and then we drove all the way to Chicago. So we had a blast. And then, you know, we are huge Cardinals fans.
Okay, we'll let that slide.
And you know, we go to spring training most of the time, and this was unfortunately during our second game loss to Philadelphia Phillies.
Oh, that's another good bonding time. And you think you're going to get your little girl in on the sports action too when she gets old enough to watch
I'm not sure she's too interested at this time.
Okay.
She's more like interested in being with her mom, and you know, but hopefully we'll see.
That's good though, bonding time. All right, now we want to get to Dr. Gupta. And speaking of family, Dr. Gupta has an adorable family, and she has some adventures. Let's take a peek. First of all, tell us where you are and who you're with.
This is a picture from Cabo. We just went in January. And that's my husband, Dr. Amit Noheria, and that's my son. He's a year and a half old. So we are new parents. We are learning to be parents.
I'm sure you'll get the hang of it. You're both doctors.
Yes.
So what kind of doctor is your husband?
He's an electrophysiologist. He's a cardiologist.
So we have dealt with him before.
Yes.
Dr. Noheria. And where are you here?
Cabo also. I think it's the same day.
Yeah.
It was very, very nice there. January, it was snowing over here, so that was a good
that's a good time to be in Cabo.
Yes.
Really. Anywhere else. Now to cardiothoracic surgeon Dr. Danter, and again, we're continuing our family theme because you have a huge family as well. You sent me probably 24 pictures, so I tried to pick a good representation of everyone. Tell us who we're looking at as we go.
Am I in any of them?
You're in some of them, but you're shadowed by adorable children and a gorgeous woman. So tell us who these people are.
I have never met these people before. This is my family. That's my wife Sherry on the right, my oldest Maya. my middle one, Kayla, and my youngest, Alyssa. That was this past Christmas, which was a busy time.
You just have
These are
lots
our
of fun.
best friends on the Disney cruise.
Nice,
aside from the
Disney
Vidic,
cruise? Yeah.
He's ex-Navy. He's good. These are my girls again.
Would you say Dr. Vidic is ex-Navy?
No. He's
Oh.
my other best friend.
I was
yeah.
like, what?
Mike, the guy in the
We know
picture
Mike
out there
is.
is Mike's
Got it,
ex-Navy.
got
This
it.
is my cheerleader. She's 5 here.
So cute.
Yeah.
And where's she cheering there?
I don't know. It's someplace in, I can't remember where. This is at the.
Who's that?
This is my wife.
The
and
missus?
yeah.
Your better half?
Yeah, 2/3. But yeah. This is my youngest. I did send a lot of pictures.
You
This is my
did.
youngest, Alyssa, getting her first haircut, actually.
Do you want to give a shout out to your kids? Because you said they're also going to be watching you on Facebook.
Well, yeah, I mean, they always say I embarrass them, which is probably appropriate.
You're doing something wrong. If you don't mortify your kids, you're
Yeah.
doing something wrong.
No, my girls, they put up with a lot.
You also sent us a basketball picture. I think we have.
Oh,
no,
yeah,
did
this
Dr.
is a
Vidic
big
send
deal.
us this?
This is a big deal.
All right, tell me who we're looking at, because those all look like familiar faces.
So on the far right, or on my right is, on my left actually is Dr. Harakshaw, who's a heart failure cardiologist. The guy in red is Dr. Vidic. You may have seen him from episodes of TV from today. My other surgical partner beside him is Dr. Tyler Zorn's one of the heart failure surgeons as well. And this was a basketball, sort of interdisciplinary basketball event between the cardiologists and the heart surgeons. And you'll be happy to know that the heart surgeons won. The heart surgeons won. The heart surgeons won.
Yeah.
21-19.
No one pulled a hammy or did anything like that?
No, I got assaulted by one of the cardiology fellows, but that's a story for another day.
All right, we're just going to give you just a little more attention, Dr. Danter, because you were recently featured in the New York Times. This is so cool. It's an article titled "The Routine Miracle of Life-Saving Surgery." That's kind of cool. New York Times does a piece on you.
No, this was on there.
Yeah, surprised. They followed you through a basic, day in the life of.
Yeah.
But day in the life of, for doctors that we have sitting with us, is saving someone's life. Like, one moment in your life is like the defining moment in so many people's lives. Is that ever weird to think about it that way?
Go.
Yeah. It's an article.
But it applies to all of you.
Yeah, I think it's something you reconcile yourself with along the way, but it's not something that we ever take for granted. But
oh, this is video of the procedure that they were talking about in the New York Times article. You're doing the coronary bypass?
I'm doing a cabbage.
Yeah.
Yeah, no, one of my friends is actually a photojournalist for the New York Times. He's a freelance guy. He's kind of famous guy named Gene Richards, and they did another piece when we were in Nashville, and he's just become a friend. He's just a fantastic photojournalist. Yeah.
You're deflecting. You're deflecting.
I get uncomfortable with sort of overt recognition.
Okay, you all kind of squirm when we do these personal segments.
It must be weird from the usual,
most people want attention.
Right.
Most people are like, give me all the attention, and you're like, no more attention. But anyway, you deserve all the attention. This has been so special. Thank you so much to all of you for being with us today, Dr. Vidic, Dr. Gupta, Dr. Danter, and thank you so much to Carlos for sharing your journey. It is a thrill to see how well you are doing now, and it's motivating for a lot of people.
Good job, Carlos.
Keep it up.
Yeah, keep it up.
Coming up next week on All Things Heart.
Helpful.
I didn't know what to do. I didn't know how to stop the bleeding, and it was really bleeding.
It's so scary, and it turns out it was a varicose vein. And what happened to Bob Trapp can happen to anyone who has them. We will explain the danger to your heart if you don't get your varicose veins treated, what could possibly happen, and how you can easily get them treated and where. Next Thursday morning at 10 a.m.